This is the Emergency Medical Minute.
I want to talk a little bit today about medical errors and some of the ways that sort of cognitive scientists think about ways we can avoid those. So in terms of medical errors, generally things are sort of divided into sort of broad categories in emergency medicine. Errors where you're failing to diagnose a condition would be the most common. Other categories of medical errors are failure to treat, failure to consult, but the vast majority of them are failure to diagnose, right? So obviously we want to avoid that, so cognitive scientists think about these types of things, and they try and understand why we are have certain biases that lead to faulty decision making. Okay, so what is a bias in general? Assumption. What's that? So that would be an example, right? So in broad terms, it's sort of a systematic error in thinking that generally negatively affects your judgment, right? So there's those, in a lot of respects, those are sort of natural aspects of human thinking. They're sort of heuristics or shortcuts that make things easier in certain circumstances. But at times it leads to a faulty logic that leads to bad outcome. So as far as sort of the three most common, I listed them up here, and we'll go through examples of each. And I think if you're mindful of those, then hopefully you can take that into account in terms of your decision making and then avoid those types of cognitive errors. So the first one there listed is anchoring. Has anyone ever heard of that term? It's actually
stuck on the one diagnosis.
Yeah, exactly. So typically based on sort of the most early available information, you anchor on a specific diagnosis and you sort of prematurely close, or you look to confirm it with sort of other factors, and you don't sort of keep the differential diagnosis wide, and you are too narrow in your focus. So a typical example of that would be something like, we're obviously sending troponin to diagnose a heart attack, and if the test comes back positive, you may prematurely close on the diagnosis of heart attack where there's other causes like a massive PE that could be causing the chest pain, and obviously the treatment protocols would be vastly different in that setting. So that would be anchoring, where you get early available information and you prematurely close your diagnosis, right? Attribution, that's sort of when people think about stereotypical thinking, sort of just in daily interactions even, then that's an example of attribution bias. So you're attributing certain characteristics to certain groups. So Emily brought that up, like a frequent flyer, or in the ER sometimes patients that have mental health issues. People make certain assumptions about why they're in the emergency room, and they may not keep their differential diagnosis wide. Obviously in society, there's other examples of that based on race or creed or sexual orientation. So clearly, those are things that we want to curb the instinct to attribute certain stereotypical characteristics to groups. So, the example would be like a frequent flyer comes in and, they come in with nausea, vomiting, abdominal pain, which 10 times has been cyclic vomiting, but, that 11th time is acute appendicitis. The availability heuristic is the final one that I was going to talk about, and that's basically something where it's just sort of front of mind because of recently being taught about it or recently being exposed to a similar patient that had a certain diagnosis, and it's at top of mind. So you saw this patient that had viral syndrome during flu season, and so you say that that presentation is due to flu, and it in fact is meningitis. So these are actually the three most common biases that lead to sort of errors in diagnoses. So I think that, on the one hand, there's sort of normal aspects of human cognition that are sort of shortcuts to more rapid thinking. But if you're mindful of that, certainly as when you're thinking about what the diagnosis may be, then you can sort of at least check those tendencies and hopefully clean up your thinking. So avoid bias.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.